Good evening, my dear old friends of Primaristic and my new friends of Primaristic. Now I am here in Riga after 1 week of Primaristic seminar, and we want to talk together on Primaristic. First, a question from you: what is Primaristic? Primaristic is the knowledge and the education of sensomotoric development of man. To understand this definition, we can compare it with the definition of psychology. Psychology is the knowledge and the education of psychic development of man. Another feature is sociology. Sociology is the knowledge and the education of social development of man. So we have three very important topics to think over, and today we will talk about the first of these three topics. We will talk of Primaristic. Primaristic is a new name which was necessary to understand what we are doing. This name was created by Mrs. Herbert Pfeiffer. She invented this name to make clear what it means in Primaristic. It was a work which began in the 1970s in Germany, in a children's hospital in Frankfurt. She was there as a physiotherapist, and she had to treat in this hospital very severe ill children after different diseases, mostly in combination with birth, disturbances before, during or after birth. So these children was premature born children with very low age at birth, children after a stroke in the brain or bleeding in the brain. So these children were prone to develop a problem with the development of sensomotoric. She had to treat them, and during her work she found out that what she learned as a physiotherapist in the university, it was not enough to help those children properly. There was an important example for her. She had to treat children with Erb's paresis. So these children had one arm with a paresis, so they could not lift up the arm. And to treat them, these children had to lie in a bed in the children's hospital with the arm fixed in a vertical position. And then she went to these children and opened the bed and took away the blanket from the bed and looked at the whole babies, and she saw that there was another disturbance. There was not only the problem with the arm, it was also a problem with the whole sensomotoric. These children were lying in the bed with crossed legs. And so she saw that there must be a very severe disturbance of the neuromuscular activity in these children. With the knowledge she had from her education in physiotherapy, she began to treat these children. But after a short time she found out that it was impossible to treat these children properly because she could not stop this position of the legs, this crossing over of the legs and the tension in the muscles. So she went to her professor in the clinic and said, "Look, I have to treat these children. I don't know how to treat. Give me the chance to learn more how to treat those children." At that time, it was usual to treat these children with Boba therapy. The Boba therapy came from England. It was an orthopedic doctor, Dr. Bobat, with his wife. They invented Boba therapy. And they invented it at first to treat adult persons after severe neurological disturbances, maybe after stroke or bleeding in the brain. And from this, they went down to the children and said, if we can treat adult persons with such diseases, we should also treat children, which are problems with the sensomotoric system and neuromuscular diseases. So they began to develop Boba therapy and to teach this Boba therapy in the world. At that time, when Mrs. Pfeiffer-Meisel asked for education in another therapy can treat these children, there was a famous teacher who came from England and was teaching Boba therapy in Switzerland. So she went to Switzerland to learn Boba therapy by this lady. She was there 3 months, and then she was perfect in Boba therapy. And then she went back to a hospital in Frankfurt and treated the children with this Boba therapy. What she did could not help them properly, so she found out that it was not enough to treat them with Boba therapy. So she looked for another way. And at this time, the new therapy which came up was Vojta's therapy. Dr. Vojta, an orthopedic doctor from Czechia, came to Germany and was teaching his therapy he invented, also in the beginning for adult persons and then also in children. So Mrs. Pfeiffer-Meisel worked together with Dr. Bobbert and learned his therapy. And then she tried to do this also with the children she had in her hospital. But also this therapy was not enough to help these children properly. Mrs. Pfeiffer-Meisel's goal was to avoid disabilities in these children, that they could get a normal sensomotoric development after these severe diseases or traumas. So she took the children with all the knowledge she had and found out that it was necessary to interrupt primary reflexes which all these children had in their diseases. The primary reflexes were well known, especially from Dr. Vojta, who was teaching how to look at the children and to find out how intensive these reflexes are in children. By this, she had the knowledge that these reflexes are important in the disease these children had. But with Boba therapy and Vojta therapy, she couldn't stop these diseases. She could not stop the action of the primary reflexes. So she was working with the children and found out that it is possible to stop the primary reflexes with holding the children in simple positions on the lap of the mother in a diagonal way, to hold one arm and the diagonal opposite leg. And by this, the primary reflexes was interrupted. So she developed a method to do this in children from the very small age, soon after birth. And by this, she could help many, many children to get free from the severe diseases and not to develop sensomotoric disturbances and disabilities. After this, she was studying how to teach the system of therapy, which she called Therapie Concept Pfeiffer-Meisel. And then she began in 1973 to teach other physiotherapists this method. And in her lifetime, then she was teaching more than 70 ladies this therapy, and these physiotherapists were in their own practice at home and helped many children by this method and it was always functioning. Since then, the physiotherapists are doing this therapy, and later on, there was a new problem. The problem was, after these children were in a good neurophysiological state and they could move properly, they learned to turn around from belly to back, they turned around from back to belly, they could begin to crawl, they could begin to sit, to stand up, and then to walk properly. But now, the therapy was finished because the goal to bring these children to normal sensomotoric development was reached. But there was a big problem. She saw that the primary reflexes was still there. And when she stopped, or the parents stopped, the mother stopped to make primaristic with the children, the primary reflexes were going on and they caused a hypertonia on the muscles. And this hypertonia acts in tonic patterns. That means the primary reflexes bring the body in a special position, symmetrical or asymmetrical, which the children cannot change voluntarily. So by these reflexes, the normal motion of the children was hindered. So it was necessary to continue with something that the good result of the early therapy of the children would not be disturbed again. So she found out we have to continue with primaristic in these children and to interrupt these primary reflexes as good as possible. The practical working showed that it was enough in a healthy person, that means a person who has no disabilities, only to prevent the new action of primary reflexes, to give them the opportunity to interrupt the primary reflexes, and it was not necessary to do it more than half an hour a day. So it was something what could easily be done every day, and then these children, and later on the elder people, and the youths, and then the adults, stayed free from sensomotoric disorders, also if there could be provoked primary reflexes. Now, what are primary reflexes? Primary reflexes are necessary in the early development of man. And these reflexes are already active more and more during the pregnancy. And why they have to be active during the pregnancy? Because the child is in the uterus, in the womb of the mother, and will be moved by the mother. This movement of the mother will also move the children. The children with their body during the pregnancy, the body of the fetus, has two big parts, the head and the body. And the weight of the head is of a higher density than of the body. So, if the mother will move, first the head will move and then the body. So there will be the neck be moved between head and body. So these reflexes act as soon as the mother is moving, and there will be a reaction on the neck by the movement between the head and the body. And these reflexes which act, two of them are named tonic neck reflexes. And we can see them in a symmetric or an asymmetric tonic neck reflex. Immediately, when the neck is stretched by the movement of the mother, the child will go into this tonic neck reflex, and immediately all the muscles of the child will be contracted, so the child cannot move longer in their own body. It is be kept totally in a tonic pattern, so the child can be moved as a whole in the uterus of the mother. So there cannot be longer be stretching on the neck. And that's what's necessary if the mother moves quick. If she moves very slow, it's not so necessary. But as soon as she moves quick, the body of the child must be stabilized. And this is done by the different primary reflexes. So we know these reflexes are necessary during the time of the pregnancy. As soon as the child is born, they are not longer necessary. If there's no more activation of these reflexes, they will cease. They can go away in the 3 first months of life. Later on, she saw that these reflexes can be activated again, more or less. So people have the primary reflexes left, and they have to grow up with the primary reflexes, which will be activated more or less. For example, if you have a little baby, 3-4 months old, and this baby is crying and moving the arms and the legs, then these movements are not voluntary, not directed to a goal, and these reflexes will activated by the primary reflexes. And then the primary reflexes cannot longer go away totally from this child. If we know this, and we then go on later on in life to continue with primaristic, that means to interrupt primary reflexes every day, then we can avoid that these reflexes make again tonic patterns with a hypertonia of the muscles. And the hypertonia of the muscles will be in the whole body, in the muscles for the skeletal system, also in the muscles for the internal organs. And if they act too much, then we go more and more into a hypertonia. And what does this hypertonia? Hypertonia means that muscles have a higher tonus and will be contracted. And if they are in this state longer and longer and longer, there will be contractions of the muscles, so they cannot not longer go back into the normal position. And we can find it in the most of people later on in life, that we cannot move the hip joints completely in an open state. Most people, if there are not longer children, cannot open the hips totally as they could as little babies. If we have the little babies lying on the bed and we take the legs on the thighs and open the hips, we can open the hips very easy, so the thighs will go down to the bed and can touch the bed on both sides at the same time. If we try this in an adult person, it's very rare that they can do it. Only if they trained it from the early childhood to do this, like dancers, for example. By this we can see that the primary reflexes with the tonic patterns influence the muscles all the time, and as we see, day and night. It's very interesting that the tonic patterns are also working during night. Normally we think that we can go down with our muscle tonus during night. But that's only possible if we have no primary reflexes. Because when we are staying in a primary reflex and we sleep, then this reflex will stay all the hours we are laying in the bed. And during this time, the tension of the muscles is augmenting. And by this, we get more or less contractions in the joints. Then can be the joints of the shoulder, of the vertebra, of the hips, of the knees, of the ankles. How we can prove this? You can prove it yourself. Try once. Before you go to bed, you stand up before your bed with straightened legs and bend your body down and look how far you can go down with your body to touch the floor with your fingers. And then you sleep one night and in the morning you do the same. And mostly you will see that the movement which is possible of your spine is less in the morning than in the evening. You can just see that the tension in the muscles of your back is more in the morning than in the evening. And it causes a shortening of the muscles. So the muscles are contracted. And if this is in years and decennials, then there will be contractures. And then you can get disorders of that. Maybe disorders of the hip joints, like a hip arthrosis, or knee arthrosis, or in the column, the contraction makes that the pressure on the column is more and more and more, so that the vertebral disc will be pressed out. Then you have a prolapse of the vertebral discs. That's are all known diseases which the orthopedic doctors deal with every day. Many, many people. But this problem we not only have in the system of our motion, we have it also in the inner organs. And there's one special disease that comes when the tension of the muscles in the blood vessel is augmenting. So the blood vessels have no longer the normal elasticity because the tension avoids the elasticity and hinders the elasticity of the vessels. And after time, we find out that the blood pressure is augmenting by this tension in the blood vessels. And then we have a disease named arterial hypertonia. And if we want to find out what this disease is caused by, we have to look in our books of internal medicine. And there we find that most cases of arterial hypertonia is caused by unknown cause. We don't know it exactly, so we name this hypertonia essential hypertonia. That means we don't know what the cause is. And now we can try to understand this form of arterial hypertonia by primaristic knowledge, by the action of primary reflexes and fixation of the blood vessels in tonic patterns. So you see, there's a great importance of this knowledge of the primary reflexes and the tonic patterns for many things what can happen in the health of man. We have two sides now. One is the health of man, and the other is the disease of man. On the one side, we have the health of man, and we want to avoid that there will be diseases in man. And on the other side, we have men with diseases which want to go back into a health state. Now, Primaristic, as it is used today, and done by the primarists who got the education in Primaristic, we see that to do Primaristic is not a therapy. What we do, what these ladies who are teachers in Primaristic do, is to teach people how to do Primaristic. And they do it in everybody who want to learn it. And everybody can learn it from the earliest age of life, of the first day of life, until the high older. And it will help in everybody. And the only thing what by teaching this, by learning this, is that the primary reflexes will not longer act so intense as before. And by this, the tension in the body, in the muscles of the motoric system and the muscles of the inner organs will diminish. And by this, it's easier for the organs to get healthy again and then to stay in health. And you can imagine that there are many people who should learn Primaristic. We can say nearby everybody, because it's very rare that the primary reflexes will be totally absent in people. So we can teach everybody, and everybody will have a profit from this. As I said, in any age, if he's in a healthy state or a state of disease, he can learn Primaristic. And therefore it's necessary to teach ladies to get teacher of Primaristic, that people can have benefit from this if they go to them and learn Primaristic. As I already said, Mrs. Pfeiffer-Meisel already were teaching Primaristic to more than 70 ladies in Germany, in Switzerland, in Austria, and they did the profession and helped many, many patients. Now, the situation is that we have to continue with this teaching of Primaristic, and it came to me to begin again to teach Primaristic because Frau Pfeiffer-Meisel, my wife, died in 2006. So I had to think over what to do. And so I began in 2012 again to teach Primaristic, and I made the first course in Germany. And now I'm here in Riga, in Latvia, and we have already the second course here in Latvia, and it is the seventh course I made until now. How it came that I came to Riga, when I was in Mexico City to the World Congress of Homeopathy, of the Liga Medicorum Homeopathica. I was in the court of the Congress Center in Puebla, Mexico. It's a little city nearby Mexico City. And a young lady was running over the court and was meeting me and said, "Are you Dr. Pfeiffer?" I said, "Yes." And she said, "Then you have to come to Riga, to Latvia." We were not talking about Primaristic, what was a Homeopathic World Congress. The meaning was that I come to Riga to teach homeopathy. And so I went in the year 2011, the first time to Riga, to the first European Congress of Homeopathy. I had the lecture, and always when I had lectures in homeopathy, I was talking about my knowledge on Primaristic. So we talked about this, and Mrs. Dr. Afanasieva, excuse me, I will learn it, asked me if I would like to make a seminar on Primaristic in Riga. And I said, yes, I will do. So we began in the year 2015 with the first seminar of Primaristic in Riga. The seminar takes 2 years. So it was from April 2015 to April 2017. And 12 ladies learned Primaristic. 6 of them Russian ladies and 6 of them Latvian ladies. And now we have here in Riga in Latvia 12 ladies who can teach Primaristic. They have the diploma of a teacher of Primaristic. And now we are already in the second seminar. I finished the first week of the second seminar today. So we will go on, and we will have in the future more primarists. Now in this course we have 10 Russian, 7 Latvian, and 1 Lithuanian lady who is learning Primaristic. So for persons who need Primaristic, who want Primaristic, there will be the possibility to learn this. Why it's necessary to teach Primaristic? Because that's something absolutely new. There's no therapy and no teaching which can interrupt the primary reflexes. For in Primaristic it's necessary only to interrupt primary reflexes. Nothing else is done. That's a very new thing. That's a new invention. For we can now teach people in a healthy state to stay healthy, not to get into a disease. What happens if I am teaching somebody Primaristic? I'm not curing his diseases if he's sick. I'm not making him stronger if he's healthy, strong in his muscles. What I'm doing, I hinder the primary reflexes to work. So he will be freed from this action of these tonic patterns, which are like a corset on the body. So his voluntary movements are not so free possible as he wants. By Primaristic, by interrupting the primary reflexes, he can more and more move himself voluntarily. And this works not only on the movement of the body, it works also on the psyche. It works also on the mind. He will be more and more free in every function of his life. And by this, he can stay healthy. As soon as somebody who was beginning with Primaristic in a state of disease is free from this disease, he should continue with Primaristic. Can be he made also Primaristic during the disease or not, but he should continue with in his healthy state, not to get sick again. So we told about the movements, which will be easier, free, and he can stay free from diseases. These diseases we have in our miasma, as we say in homeopathy. That means miasma is the sum of all inherited disorders from our ancestors, which are in latent state in our body and can be activated earlier or later in life. And the activation of this miasma can be by primary reflexes. By the tension the primary reflexes make, the latent state of a miasma can get into an acute state, so the disease is beginning. And this is what we want to avoid. How to do Primaristic. If we teach somebody Primaristic, in the beginning often is the question, how can I do it? I have no time. Nobody has time, because we are alive, we are doing something, we are working, we have families. We cannot get new time, we have our 24 hours. So we must look where it is possible to make primaristic. So we combine the primaristic with the sleeping time. Every man has a distinct time for sleep. Maybe some 6 hours, some 9 hours. That can be different. But the time we need for the primaristic, we must take from the sleeping time. This time we have. In this time, we do nothing else, we sleep. So we can take in the morning a part of the sleep, and in the evening a part of the sleep. And we found out that the recreation we have by doing primaristic will be in any way as good as the sleep. Very often we see it's better recreation by primaristic than by sleep because we are without primary reflexes. So the tension of our body is less and therefore the recreation is better. As I said, we need about half an hour of primaristic a day to stay in a healthy state, to interrupt our primary reflexes enough not to work and not to make a higher tension in our body. So, how we do it? I have to stand up in the morning at 6 o'clock, maybe. So I stand up at 5:30 and go into my primaristic. The first position we have in adult persons is to lie on the belly on the floor and to stay in this position as long as it is possible for me, but not longer than half an hour. That's enough. And if I feel during the day that I got tensed by my work, my physical work or my psychical work or my mind work, then I can go into the primaristic again before I go to bed. So I need only to take a part of the time for my sleep, maybe 15 minutes or 20 minutes before I go to bed. I lay down again on the floor. It's very easy to learn, but it is not so easy to do it, to change the habits from the sleep. But if you want to do it, then you will be used to do it every day. And you must do it because you want it yourself. It's of no use if you say to another, do it. It's your own will. You must be behind all this. But after a short time you feel that's very good for you, so you will continue. In children, we do also primaristic. You know that the primaristic was beginning in the work with children, to help children. But in the case of little children, we need the mothers to do primaristic. So the mother will take her child on the lap and having her child in the position on the belly on the lap. That's the beginning of the primaristic in a child. And it's the same, the mother will have her child half an hour on the lap. So we can give primaristic to everybody in any age and in any state of health. We try to help in different problems. I told about the problems of the body, the joints, the muscles. But what's about the psyche? Our psyche is a part of our whole body. And if I'm acting with my psyche, I need my body. So we have not only sensomotoric for our movements, we have also psychomotoric. As good as I can move my body, I can be in my psychic state. In the same way as my body can get stiff by the tension of the muscles, my psychic reactions can get stiff by the tension of the muscles. I cannot move so good in my psyche to change from one feeling to another. And we see then, if patients or pupils are going into primaristic and learning primaristic, the psychic state changes. They can more and more act without fixed psychic patterns. The same way as we have tonic patterns in our movements and body shape, we have psychic patterns. Earlier in time we said complexes. That means that we react in a situation always in the same manner, but that we will not be good because different things we are hearing, seeing, smelling, tasting, touching with our senses cannot give always the same pattern, but it does give the same pattern as long as we are reacting with our tonic reflexes, with our tonic patterns. So the same what happens in the movements happens in the psyche. If I go in for my primaristic every day, I will change. In this last course, one lady said her husband said to her, look, you are now in this course of primaristic, and every day you came home from this course, the first day, the second day, the third day, the fourth day, you was more kind, you was smiling more. There was a change, what she herself didn't mention, but her husband mentioned it. And the change was because she was doing primaristic every day. So to do primaristic is a great profit for every healthy man or woman to get more mature in her psyche. And we all can get more and more mature during our whole life. Only if we are fixed in the tonic patterns, then it's very difficult. Where the primary reflexes are acting? They're acting in all our senses. How we feel, how we see, how we hear, how we smell, how we taste, all is more or less, better or worse, how the primary reflexes are acting. The more the primary reflexes are acting, the less I can feel, I can hear, I can see, I can taste, I can smell. The senses are very important in our life, during the whole life, and especially important in the time of our life, when our life is in the main the life of learning, when we are pupils. And in this time of life, we see that a lot of school children have problems in learning because they have problems with their senses. They have problems with their concentration. And we also find them then, they have problems with their emotions. And then, when we're going in for primaristic and teaching them primaristic, then we see very soon that there a change is coming up. They can learn better. They can be better concentrated. They have less diseases. They get better in their emotions. So the whole life is changed. Sometimes I tell school children, if they need a motivation to do primaristic, say, look, if you now do your primaristic every morning, I can tell you that in the next school year you will have better numbers as the year before. That will happen. And if they do this regularly, it will succeed in this way. What I try is to teach as much as possible ladies to the primaristic, that they can get teachers of primaristic for other people. So I was beginning with the first course in Germany. Meanwhile, I have the third course in Germany. One course were 8 ladies, the other 14. And this one now are 18. And I have already finished 2 courses of primaristic in Romania and Bucharest. So now we are in the 7th course here. I'm very happy that these ladies come to learn this. Some are doctors, some are physiotherapists, some are logopedists, and other professions which has to do with people to treat them or to help them. So from every position, from every profession, it's possible to go into Primaristic and to learn Primaristic. So they learn Primaristic by their own doing. To teach Primaristic means that we have to teach the others to do it. We cannot understand it by reading, we cannot learn it by seeing, we learn it by doing. Learning by doing. Because we have to feel what we do in Primaristic. We cannot understand, we have to feel. And that's special in Primaristic, that we have to do a lot of work, practical work, in the seminars, to go in with our body into the Primaristic. And then we will have it in us. We can teach it to others by our own feeling and by our own body knowledge. It's not the intellectual knowledge. It is the perceptive, the sensual knowledge we need to do Primaristic. So we look to get more and more interest in Primaristic in all professions which deal with men. That begins the normal life with the midwives, then with the teachers, kindergarten and in the schools, and later on with all the therapists which are necessary if there's disturbance in hearing, seeing, moving, and then in doctors who treat patients with severe diseases. And for them, we not do interfere in their work, what they do as doctors or as therapists or as teachers. We teach only how to interrupt primary reflexes. So the teachers in primary reflexes are no therapists, they are teachers. And in anybody, they have to teach the same, like the same language in different people. What will be the future? For me, the future is to teach Primaristic in different countries, as long as it's possible for me, and then to bring the teachers in a state that they can teach later on also Primaristic. And in every country I teach Primaristic, it's possible to have people who can continue later on. So we hope that we can spread Primaristic more and more. And that will be a great chance for everybody. Maybe this Primaristic is a little revolution. That means a change which is possible first when we know what the primary reflexes are doing in our body. Now we know it. And we can see these reflexes very early in life. This is the work of Dr. Reuter, who gave us instrument to make examination already in little children to see how the reflexes are working. These are the 7 Reuter reflexes we use in the examination of children, young children and elderly children. And by these reflexes we see very early in life if there is a necessity of doing Primaristic. As we know, we can say nearby everybody needs Primaristic, more or less. And to do it every day, half an hour, that's possible. And if we succeed to bring this to people, then all of them will have a great use for their whole life. And if we help somebody in his own life, we will help him in all connections to other people. First in the families. The relation between people who make Primaristic are more easier and more uncomplicated because they don't react more with primary reflexes, with psychical tonic patterns. Their children have a better way to develop and to be educated because Primaristic influence also education. We learn by Primaristic that we have to educate children not only with words, with orders we give to him. We have to teach them by the senses. And the senses will be more and more active and proper acting if they do Primaristic. So children which are educated from parents who know Primaristic, do Primaristic, and use Primaristic in the daily education, they will be easier in life for themselves and for the others. We saw also in very severe disturbed children that Primaristic can give help and change a lot. For example, in autistic children. That's a problem of today, that we have children and later on elder people who are autistic. But they also have great acting of primary reflexes in their bodies. And that makes them the problem which leads to autism. If we have very severe acting primary reflexes, these reflexes influence also the psyche. And these people cannot develop the relations between the early relation with the mother and father, with the parents, with the families. So they stay in a very immature state of interaction between other people and themselves. As soon as we can interrupt the primary reflexes, they can be developed because the primary reflexes are blocking the possibility to interact with other peoples. One example, what I saw, how primary reflexes can block something, was in a little baby, newborn baby. One of the primarists I had in my course in Germany, she came in the morning to the seminar, and she told us that just this day a mother was calling her up with a newborn baby which could not drink properly on the breast. And she did not know what to do, if she could help her. She was in the seminar, the beginning of Primaristic, and we taught her what to do to bring the mother with the child together, that the mother could do the position on the belly, on the lap. So she went home immediately after that. We were teaching this to her, and then she was teaching the mother with the child. And then she came back the next morning into the seminar with a bright face, laughing, and she said, "Look, the child can drink on the breast." This blockage by the primary reflexes was away. So this child must not go to the clinic to get another method of getting meal or milk. And this blockage by the primary reflexes we see in every kind of state of diseases. And what we do is only to bring away the blockage. All other things which are necessary to treat somebody, the doctors and the other therapists will do. What we wish in Primaristic, that many people can take part in Primaristic. And the basic is that we have therapists, that we have primarists. And as here in Riga, there will be new therapists. They will be finished with a diploma in 2 years, and we will work on that. So we'll see how it's going on. I will do my best and go further on in Primaristic. And I'm very glad that I have today the opportunity to speak on this topic, because that's a way that you can hear it, that you can take part in it and look for a primarist to learn it yourself. And if you do it, I'm sure that you will feel after a very short time that's very good for you. I think that's enough for today to think over, and you can look for a primarist to learn it yourself. If you self-learn it and you feel well, you can recommend it to others. That's a way to spread something. And sometimes in the world, there are new things, new inventions. And this is a great thing to spread because it's easy to do and helpful. And so I wish you to go into Primaristic. My best wishes to you and for your future life.